Yeah. I feel like I haven't seen you in a while, Bruce.
Well, it has been a while. It
Yeah.
has.
Yeah. Well, this is nice. Yeah, I thought we'd use this software, this podcasting software, to try and create a bit of a video dialogue for people in Canada who don't know about what's going on right now. And so, just as a bit of an introduction to it, and maybe as an introduction to our call and to set the tone, Bruce, um, I think what we've discovered here is an issue in Canada where doctors don't have the ability to do what's best for their patients and don't have the autonomy to help their patients get access to certain substances. And I think we've seen that in Canada before, with doctors fighting for patients' rights to abortion, to medical assistance in dying, and to cannabis. And we have a healthcare system that prides itself on being patient-centered and caring about patients, but then goes ahead and ignores patients, and not any patients, but patients who actually have the right to die in this country with medical assisted dying, but not the ability to access psilocybin. And as far as I'm concerned, you coined that term. If I have the right to die, shouldn't I have the right to try psilocybin? And surely we know that that's true for medical cannabis. And so the question is, well, what the hell's the difference between medical cannabis and psilocybin? We have mushroom stores open in BC and Toronto now, and we've also got a court case that you're taking part in and that you've been working on since, I think, 2017 or maybe even earlier.
Mm-hmm.
And the whole court case is almost ridiculous because the writing's on the wall. We know that patients and healthcare practitioners should have access to medical psilocybin. In some cases, such as your own and Thomas's, you've actually been granted access and then had it taken away, which is ridiculous.
Yes.
And as I'm saying all of this, I'm realizing that there's almost too much wrong with this for the average person to even comprehend and digest. And it almost looks a bit like scandal to me because as far as I can see, what's happening is we've got a court case now that's happening that will probably take a year and a half. It'll cost lots of lots of taxpayer dollars. And quite frankly, it's only happening because politicians are too afraid to do what's right. So with that, Bruce, I want to introduce you as the founder of TheraPsil, the magnificent Bruce Tobin. And I'd just like to hear from you. What is TheraPsil about? Why did you create it?
Well, TheraPsil arose in response to my being confronted by abject misery on the part of some of my patients. These were dying patients who had nothing to lose by trying psilocybin because they'd already exhausted all the other medical alternatives. And so they were desperate. And I was aware at the time, and this would be back in 2015, 2016, that yes, there was underground therapy going on, but it was rather unsafe in that it was difficult to find out the credentials of the people who were treating underground, and so my mission became to make psilocybin legal as a medical treatment. And I remember saying to myself, and this is probably the one kind of thought that got the whole thing going. I remember saying to myself, before I die and retire from practice, I want to be able to use the full range of resources that are possible to use with my patients. So that got me going, and I had read about the success of medical cannabis in the court system. I'd read about the R versus Parker decision way back in the year 2000, in which the Ontario Court of Appeals said that the failure of the government to allow cannabis for medical purposes constituted a deprivation of freedom and security of person. And that major decision was confirmed again in the R versus Smith case in 2015 or 16. And that was about edibles. And the court again, and this time it was the Supreme Court, they affirmed that the denial of access to medical edible cannabis was also a violation of the charter rights to freedom and security of person.
There's a pattern here, isn't there, where the court gives in and people keep having their rights to essentially do what they want when it comes to medical access to cannabis and other substances. No.
Well, the irony here is that it was Justin Trudeau's father, Pierre Elliott Trudeau, who brought the Charter of Rights and Freedoms into effect in Canada in the 70s. And it's his son that is failing to live up to the provisions of his father's charter.
Yikes. And I mean, put it bluntly, too.
It was
the only people that can help, right? Him and the health ministers.
Yes, and it was Pierre Trudeau who said in relation to issues of sexual and gender equality and gender rights, Pierre said in the late 70s, the nation has no place in the bedrooms of Canadians. And in like manner, today we say the government has no place in the medical consulting rooms of the nation.
Well, and that I believe in so much because, we are not alone in this. There are people that are looking to get access to heroin, right? Safe injection, folks that are trying to get access to ibogaine, to even emergency cancer treatments. In the U.S., we see what's going on with the overturn of Roe versus Wade. There's this insistence that the government has the right to interject and jump into and make things that are medical, political. And I think that's an absurdity that we need to get past, is it not?
Well, I can understand that a government that was among the very first in the world to legalize cannabis across the board for medical and recreational purposes, and they took a good deal of heat for that. And I applaud them for the courage of the MPs that stood up and voted for medical cannabis at that time. But I understand that there's a good cohort within the Liberal caucus that would dearly like to see psilocybin legalized for medical purposes. But there is a lot of trepidation. And I would not be surprised at all if in their heart of hearts, the government is happy that we are taking this to federal court, because I think they would like to see a judge make the decision so that they don't have to take the political heat for doing so. But I mean, time is on our side, and you've been with this just about as long as I have now, Spencer, and I think we can both agree that we've come up to a tipping point in terms of the sentiments of Canadian society at large. Back in 2015, 16, it was very difficult to find one medical doctor who was sympathetic to us. Now there are many, many doctors and even psychiatrists that are directly and overtly supportive of us. And we've seen the polls change as far as Canadians at large, that the vast majority of Canadians now have had some exposure to the fact that medical psilocybin is not just a new thing, but it is a very, very effective treatment uh, with results head and shoulders over the whole range of conventional pharmaceuticals that so unsuccessfully treat things like depression and anxiety and end of life distress today.
Well, for sure. And those poll results I always find incredible because,
Yeah.
while we've only been in this for a couple of years, I certainly was new to lobbying and to advocacy work that we've been doing. I would have thought that by the time 70 to 80% of Canadians agreed on anything, which we couldn't even agree on whether or not masks or travel bans or anything like that were suitable or if COVID was even real. Yet we've got a large majority, beyond landslide, of Canadians agreeing that psilocybin should be made medically available. And then the politicians ignore it. To me, it makes no sense. I see it as a political win, kind of like we had Trudeau introduce the medical cannabis regulations, and that was, a platform that people could vote on and that he could stand on.
Yeah.
I don't see why they aren't doing the same thing for psilocybin, why they're making us go to court. And do you really think it's just political cowardice, or do you think it's something else?
Well, I haven't heard any arguments against the positions that we've taken because I don't think there are no scientific or medical or psychological arguments that have come to light against the use of medical psilocybin. And if we look at the research literature over the past 5 years, we see that the number of clinical studies it's exploding, and the interesting thing is that all of the studies are backing one another up. There are no studies that have come out around medical psilocybin in the last 10 years that have taken any substantial disagreement with anything that earlier studies have shown us. So there's just no argument on the medical or psychological side. And so other than, and yes, this is an issue where there's more general support among Canadians for medical psilocybin than there is for just about any other political issue in Canada right now. So
we're still silenced.
yes, it's hard to understand what the reason would be other than fear of political heat. And I'm not sure whether cowardice is too strong a word to use, but there's certainly trepidation there. And it's sad because not only do we have a great number of Liberal MPs that would be supportive of us, but it's interesting how we've attracted the interest and support of some of the Conservative MPs who understand, who have problems with, for one reason or another, with MAID, and understand that if we open the door to the right to try, there will be significantly fewer people inclined to open the door to the right to die.
Well, and I want to defend, I do think it's cowardice. And here's why. There are patients that you're working with on your case who are dying. And not only are they dying of a terminal illness, cancer, but they've had access to psilocybin in the past. And the answer is so easy. It's so clear. I almost, if it's not cowardice, I don't even know what else it could be. Because we've been very, very clear, both to those politicians, Caroline Bennett, Jean-Yves Duclos, that this is the case, yet it's being pushed aside. And so there's another kind of theory that I've been working on that it could be as well, Bruce. And this is coming out of, there are 2 court cases that we're working on that you're involved in. The first is, of course, the biggest one, the most important constitutional challenge that aims to strike down the prohibition of psilocybin. You're one of 8 plaintiffs.
Yes.
But the second one is the judicial review for the exemption that you and 18 other healthcare practitioners were given back in December of 2020.
Right.
You and 18 other healthcare practitioners were given the right to use psilocybin in accordance with our training program, right? So that decision was made. We thought that there was a precedent set, and you were able to complete the training along with 18 others. But the Minister of Health, the new Ministers of Health, when they came in, departed from that decision and decided that they would deny, and it may not have been the Minister of Health, but certainly Health Canada, started to deny the applications for healthcare practitioners. And we'll be speaking on this podcast with Nicholas Pope, who's the lawyer running that.
Yes.
We found internal memos that state what we've been stating the whole time. As Health Canada has been denying these exemptions, they've been telling both healthcare practitioners and patients to do clinical trials. But we've had the same strong stance that clinical trials would be virtually impossible, but more importantly, unethical, given the circumstance. And within Health Canada, they actually have internal memos and documents that they've had to give to us because of the court case that state the same thing from their own Office of Clinical Trials.
Yes.
So,
well, it's really hard to imagine that we're not getting the runaround here. I mean, the first door that we knocked on was the Section 56 exemption route, an exemption to the Controlled Drugs and Substances Act. And for a while, well, we learned how to make that work for us, and for a while it did. But then when they started to see the success of our use of the Section 56 door, they closed that and they opened the SAP door. And that was a much narrower door and much more difficult to get applications through to acceptance. And in that regime, it was no longer the patient that made the application. It had to be a doctor. And so we learned how to make that door open for us. And now that that is approximating a success, as we've learned how to fill the paperwork out and make those applications efficiently, they're closing that door. So it's a bit of a shell game, isn't it? Start over here, but no, we're going to close that door. And now what? We're the clinical trial route. Well, what's a clinical trial in this specific case? Nobody knows, and nobody's telling us. How long would it take to get an application for a clinical trial through the customary ethical review boards? It usually, for most clinical trials, that's a period that takes months and months. How much money would the clinical trial take to run? Again, nobody knows, because nobody knows where the goalposts are. So again, we're being frustrated, and thankfully, we've had the foresight all along to understand that when the going gets really difficult, we have the legal argument and the legal process. And so, despite the games that are being played with us by Health Canada, for whatever reason, I'm confident that this legal route will put an end to this nonsense that we're having to deal with, and put an end to the fact that dying people are suffering every day that Health Canada and the government plays these games with us.
Well, and that is the most important piece here is, every time we go to Health Canada, and, these are people, but it's also a bureaucracy, and, bureaucracies don't have hearts. Ministers do, right? Ministers of health, they're elected officials, but these bureaucracies, there's too many people to hide behind, too many layers, too many guidelines. And, I think one of our doctors in Ottawa, in response to one of these Health Canada bureaucrats who was saying that, patients would have to try ECT, what's that, electroshock or electroconvulsive therapy, before they were able to access psilocybin through the SAP. He just said to them, are you a doctor? Are you, why are you making this assertion? And they said, oh, I'm a pharmacist. And he said, well, And the pharmacist said, we're told to follow guidelines.
Yes.
The doctor said, well, I'm a physician, and I'm told to be a human, and to look
Yes.
at what these patients want, and to properly make judgments on what medicine is most reasonable based on not just what the guidelines say, but what the human says. And when I think about you and Thomas, I think that here are two people who have done psilocybin legally with the government's permission. It has worked very, very
Yes.
well. And
Yes.
now we have a bureaucracy with no heart that's saying you don't get access again. In fact, you've got to go to court. And we've got ministers in Ottawa who have the ability to help you, but they're ignoring you. And that's the real issue here, I believe. Minister Caroline Bennett, Dr. Caroline Bennett should know this. And I hope she can hear the plea from you and the other patients, because it's about compassion. And you have a unique ability because you can talk openly about your psilocybin experience because you had a legal exemption. And so was it dangerous? Was it something that you think the government needs to protect you from?
My psilocybin experience was a real corner turner for me. I was, because of my own medical condition at the time, and I had full-fledged cancer in 2020 and went through an operation where an organ was removed. And I'm telling you, that whole experience really helped me understand in a heartfelt way, and not just intellectual understanding of what the patients that I had treated and were treating were going through. And I understand now first person that conventional anti-anxiety medication and conventional antidepressant medication just doesn't really cut it. And I challenge the bureaucrats in Health Canada. I challenge the MPs in the Liberal caucus to step up to the plate as human beings. And I would challenge them to look directly into the eyes of the patients that I have to look into when I tell them their government is not willing to support their desperate desire for medical relief.
I mean, I think of a couple times when we brought patients to those meetings with Health Canada. I remember Janice Hughes, one of the women on the court case right now. The bureaucrats at Health Canada, this was a representative of Health Canada, I forget her name, and I probably shouldn't say it either, because she said right to Janice, we're concerned about your safety, right? This is all about safety, and that's partly true. But the Controlled Substances and Drugs Act is also about health. It's about making sure that people are healthy and safe. And I think there's a point where you've got to look at, they're concerned about her safety and her health. That's what they're saying. But Janice's response was, how patronizing it is that at the same time you're telling me I can't have psilocybin because you're worried about my safety. You're giving me the ability to access medical assistance in dying in as little as 10 days. Yet, I think at that point, by now she's been waiting probably a year for her exemption on a 2-year prognosis. That's quite brutal. And I really think that at a certain point, the government starts doing the exact opposite of what its regulations purport to do, which is increase safety and health, because patients are being forced underground. They're being forced to do things that really aren't as safe. What's your take on that, along with, breaking the law with these mushroom shops that are opening up?
Well, I'm just outraged when I hear patients saying, why is the government making me a criminal in order to get my medicine? Do I have to die as a criminal? I've been a law-abiding citizen and a contributor to Canadian society all my life. And this government is going to force me to die as a criminal? I find that disgusting and really morally reprehensible. And as Canadians, I think we have a right to ask for a higher level of ethical behavior than that from our elected representatives.
I think you're
They're just
absolutely right.
right out of touch with the amount of absolute pain and suffering that they're creating because of their lack of willingness to step up to the plate and make the decisions that need to be made in order to help these patients.
You're abs- you're absolutely right. And these patients, they are making that statement. They're going to Ottawa to lobby the minister. They're putting out videos.
Yeah.
They're writing letters. But at the end of the day, they're also being ignored. And the minister is not responding to them. I mean, I doubt the minister's responded to your Section 56 requests either. But,
Well, I did
way
have
around that.
I did have one letter of response in which they began by telling me how sorry they were to hear of my medical plight and assuring me that they would hear from that I would hear from them soon. It's been now weeks and weeks and weeks.
So they made you wait how long?
It's been a number of weeks.
I think it's been months now, no?
It's getting to be months.
Okay. And then there are some patients that have been waiting for over a year, well over a year. And I've got a letter here. This is the standard thing that they send back. And, I think this just signals how removed we are from the humanity of all this, is everyone gets the same letter that says, thank you for your correspondence as of, June 17th to the minister to ask for psilocybin for medical purposes under the CDSA. Yeah. We would like to begin by telling you how sorry we are to hear about your illness. Thank you for taking the time to write and share your story. And it goes on to explain that, the Section 56 is not to be used, and that, we're working on your application as fast as we can, but we encourage you to do the SAP or clinical trials. I mean, what does it feel like as a Canadian citizen, as a therapist and a patient, to get a letter like that?
Well, it feels like I am not being heard. It feels like I'm receiving something from someone who not only does not understand my medical situation, but doesn't really want to understand it because it'll be inconvenient for them. And it feels like I'm receiving a letter from someone who just doesn't know how to empathize as a human being and respond on a human level to the plight of individual patients. So yes, I'm not only deeply disappointed, I'm angry at the reluctance of my government to take my problem and the problem of my patients seriously.
And that is a serious thing. I tell every person who TheraPsil supports, at this point it's been hundreds and hundreds, that when you're saying like, my exemption, me, it's never really you. It's never really just you. It's all the people who this could affect, and it's setting a tone for the rest of Canadians who need access. Now we have thousands and thousands of people on the wait list, and so it really is. You are a representative of all other healthcare practitioners, and at this point now patients who are looking to access this. And I think that anger sometimes is an okay response, because similarly, it's what I feel when we bring messages like these to these bureaucrats, who, for lack of a better word, tend to gaslight patients and healthcare practitioners, saying that they're working on something when we know, as a matter of fact, that they're not. That there's a freeze and that they are not working as hard or as fast as they can. It is a downright lie. And I think that's part of the problem here, is that that's happening. And, I hear over and over again people telling me not to, speak too ill of the people at Health Canada or of the politicians. But I think they're wrong. I really think they are wrong. And that at some point we need to be able to point out the things that are wrong and that are going on within Health Canada and our bureaucracies and our government that are just un-Canadian. And to be angry at that is good. Now, to be violent, that's not right. But to be angry and to respond with a court case, to respond with these videos, I believe it is the absolute right thing to do, because what we need is for the people within Health Canada and the government to step up and act like human beings, to have some compassion. And I believe that's why we've always been asking for compassionate access here, not to follow guidelines. Guidelines won't get us anywhere here. It needs to be compassion.
Exactly. Now, anger is a response, a healthy response to injustice. And if we're not able to feel anger, we don't have the energy we need to deal effectively with social justice issues. And this is another justice issue in a long string of them in Canada. Rights of minorities, rights of gays, and now it's rights of patients. And each one of those struggles, the struggle for among women to vote, even, each one of these struggles have demanded that we reach inside and get in touch with our inner warrior and be willing to enter into struggle. And the struggle involving righteous anger, where the anger is there because we understand that our elected representatives are not stepping up to the plate and doing what's right. They're hiding behind the skirts of the bureaucracy.
It's absolutely right, Bruce. And I encourage everybody listening to this and who's been supporting TheraPsil to continue, not to feel like your voice doesn't matter, that it's not being heard. There's that Margaret Mead quote, never to doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And if that is an evidence in what TheraPsil and what you've been able to achieve in the last 2 years, getting access for hundreds of patients, then I don't know what is. And I know that will be the answer here. Because I'm hoping, and I'm sure you are too, and thousands of other Canadians, that this is not something that gets dragged on for 2 years in a long drawn-out court battle. There is no reason that the Minister of Health and Justin Trudeau, so that's Caroline Bennett and Justin Trudeau, cannot step up right now, look at what's going on, reach into that human part of them, should it exist, right. I know it does, and make a judgment call here to move towards medical regulations that actually enshrine the rights of Canadian citizens, their charter rights, right. And not to play this foolish game that only puts the government in a position where they're being forced to do something much later and leads to suffering for the patients who are being ignored right now.
Yes. And the rights issue has always been important to me. I mean, there's the scientific and the medical questions about whether psilocybin is safe and whether it's effective, but on a more fundamental level, this is a question about what it means when we say Canadians have the right to life, liberty, and security of person. Are these just lofty, vacuous words? What do they mean when boots meet the ground here? Does the right to freedom include my right to make medical choices, in situations where my life or my medical health is threatened? And the courts in at least 3 landmark cases have affirmed that that's what freedom means. And so I'm hoping that Canadians will not only stand up for psilocybin as a medical treatment and the right of patients to access that. I'm hoping that Canadians will stick up to affirm their right to liberty and security of person.
That's amazing. And I believe that's so true, because psilocybin is one of many things that may apply to. I know that people are looking for access to other substances. In many cases, they use the SAP. In others, they don't. I think this is something that we struggle as a country to fully comprehend, is
Right.
that charter. And I believe that this exercise of testing the charter, right, of going through the motions of living up to the charter is necessary. And I believe that this is something that everybody in Canada should be rooting for, that our charter may actually succeed.
Yes.
It is, I believe, one of the founding documents of Canada, made by a great man, and I hope that his son can live up to him.
Yes, we're about to find out what the substance of the charter really is with our upcoming court case. So yes, I can understand the reluctance of politicians to deal with a sort of a sensitive, difficult issue as they see it. But what I cannot understand, Spencer, is the willingness of the Canadian government to go forward into a court case that is going to give optics in the media that are absolutely going to be withering for them. I mean, how is it that a government can maintain self-respect when it becomes apparent to all Canadians that they're denying solace and comfort to dying people? I mean, and this is a liberal government here, a government that um, has endorsed the concept of compassionate care. And this concept of compassionate care is really at the heart of what we've been wanting all along. We haven't been trying to make an end run around the scientific milestones that we have to cover in order to get a drug to market. We're not trying to say, oh, this drug is, we know we don't have to run it through the rest of the clinical trials to get it to market. No, we're saying we want people to be able to try this medicine who have tried everything else. And that's the underlying idea of compassionate care. Now, the Special Access Program, which has been in effect in Canada for a number of years now, it was set up as a compassionate care program for, I think, for cancer patients who had tried everything else, and it allowed them access to experimental drugs when nothing else was working. We're seeking access to psilocybin for the very same reasons. So there's no argument over whether compassionate care is a legitimate principle. The government accepts it every bit as well as they do, as we do, on paper at least. And the other thing has to do with the principle of um, patient-centered care. Now, this is a new standard of medical service delivery that started to come into Canada, shortly after the year 2000, and in the early years of this century, both the Ministry of Health in BC and the Ministry of Health in Ontario put out a thick and comprehensive document committing their healthcare systems to the principles of patient-centered care. And the primary principle there is timeliness of delivery of medical services. And this is one that has been just so clearly violated in a way that at this point leads us to disgust.
And it is disgust. I mean, you were just mentioning you don't know why, right? These politicians would go to court, and I hate to say it, but they'll do it as long as they can get away with it. And I realize that they're busy. I realize that there's lots of agendas. I realize that they're trying to get voted in. But until we can make this a national upset and put enough pressure on the Minister of Health to actually deal with this, as long as this can get swept under the rug and be only an issue that's, in a backwater town in Canada,
Yes.
Victoria, which is
Yeah.
not that backwater, it will be ignored. And so, we're trying to grow, and this is where we need support from the Canadian public, because if this is ignored, they'll never do anything. And I hope that by the time we have a hearing, the government starts to change their mind, but that'll be a while. That'll be about a year. And that's when people start paying attention to these court cases. And so it's sad that over the next year, no one will be paying attention to this as we get it set up. The only opportunity we have is to raise the voices of patients and healthcare practitioners such as yourself to make this case known and to expose this to the Canadian public. And that's the point of all of this. So Bruce, I think this is all the time we got for today, but I am excited to have you back on this podcast or video log, whatever it'll turn out to be, so that we can continue to let people in Canada know what's going on. And I'm sure they'll be seeing lots of you in the news very soon.
Indeed, I hope they will. And you'll be there too. In closing, I just want to express my thanks and gratitude for all that you've given TheraPsil over the last number of years, well, since 2019 when you came on board. And you're part of the heart and soul of this, Spencer. And so thank you once again on behalf of me personally and on behalf of all Canadians.
Awesome. Thank you very much, Bruce. I couldn't have done it without you and our excellent team and all the supporters we have.
Yeah.
So
yeah.
Wonderful. Well, let's end it off here. Thank you for this, Bruce.
Great. See you soon.